So here in section 4, we're going to talk about sleep, which is such a good habit. I would say this is like my favorite activity, if you could just call it as an activity. But sleep can help us a lot. It can help us to have a better immune system. It can help us a lot to just have a better mental health. For example, whenever you are just anxious or nervous, it can impact your sleep quality and it can reduce your well-being as well. And vice versa. Whenever you cannot sleep well, you don't feel good the next day. You might feel anxious, nervous, or you might just actually feel like unbalanced. This is like totally me. Whenever I cannot sleep, I would be such a monster the next day. But one interesting part about sleep is just this is like the most abused habit. Um, because whenever we do have like some important task or whenever we want to have more fun, the first thing that we're gonna cut off, it's gonna be our sleep hours, right? For example, if you do have an exam or if you have like an important job to do, or if you are outside having fun, you don't care about sleeping 8 hours the next day, right? You would just say that, okay, I'm going to cut off on my sleep hours. I'm going to sleep 2 hours, but I'm going to have more fun, or I'm going to study for my exam. But this is very bad, especially in a long run. It can impact your mental health a lot. So we do have like two categories for sleep. The first one gonna be non-rapid eye movement, which gonna be NREM. Some people they're gonna call it NREM. It does have like four stages. In a stage one, which gonna be the lightest and the earliest stage, um, they're gonna be like theta waves, which is like the main characteristic of stage one. In a stage two, our heart rate gonna be even out, our body temperature gonna drop, and we're gonna have K complex waves. Um, okay, in a stage 3 and 4, it's gonna be deep sleep, and it's gonna be marked by delta waves. All of the sleep content's gonna be actually filled with Kanye memes, because like he's such a character when it comes to sleeping, and I guess you all know that his new album is just coming out soon. I guess it came out, I don't know, I have to check. But yeah, all the memes is about him, because I thought that you're gonna remember the whole category of sleeps better. The next category gonna be the benefits of NREM sleep or non-REM sleep. It's gonna be it can help us a lot to just have a better level of energy next day. It can actually strengthen our immune system, like I said, and it can help us a lot to release growth hormone. So it is just very necessary for people around their puberty, because at that point they're gonna be like a lot of growth hormone, and they have to be they better to be released at that point, right? Because otherwise, children at that age, they might get some serious problems because of lack of sleep or something like that. So another category of sleeping gonna be REM or rapid eye movements. At this point, actually, our eyes gonna move back and forth. Our breathing gonna be like vary, like it is just depending our heart rate. Our breathing gonna vary as well, and we do have dreams, and that's why like we gonna breathe like in a different way, or our heart rate might be less or more, because like we are having maybe a bad dream or a good dream. I love REM. I feel like it is like the best part of sleeping. REM is just very important, especially for solving problems. It can help us a lot to actually consolidate our memories, and it can help us to turn our knowledge into long-term memories. Um, Sleep and health. Like I said, sleep is just very abused, because like roughly 40% of adults, they are sleeping less than 7 hours per night, which is very bad. And 1/3 of adults in the United States, they are experiencing sleep problems. Sleep problems, they are very serious. I'm telling you, like I can hear from like so many people, especially myself. Like whenever I'm having a due date, or I do have like a deadline, I get a sleep problem, which is very bad. Your book provided some solution for that. For example, I mean, there are a list of solutions, but one of them that was very interesting to me, it was like saying that if in the middle of the night you are actually waking up and you cannot go to sleep at all, just go to another room, start a book or like read a book. Then if you feel sleepy, come back to your bedroom and sleep. Like you cannot read at your bed because your brain should be conditioned that this bed is related only to sleeping, not about reading, not about eating. So whenever you are just condition yourself that this bedroom and this bed is all about sleeping, you can actually sleep better. So that was a point that I knew that, but I never applied. So I decided to apply that. So we'll see if it can work for me. But I guess you all had maybe, I mean, you all have like the same experience at some point. If you have it, just send an email and tell me about this. I'm really all about hearing about your experience. So insufficient sleep, it can affect our mood. Like I said, I'm gonna be a monster the next day if I wouldn't sleep. Job performance, of course, especially like if you are having like a job that is really like related to high brain activities, or you have to be cognitively very alert. For example, whenever I'm doing analysis or I'm coding for some projects, I have to get to sleep like 10 hours to just perform well. Sleep can impact your quality of life, cognitive functionings, and general health. Reasons for lack of sleeping, it can be stress. Like I said, high level of stress can actually bring some problem for sleeping. It can be maladaptive behavior, which is going to be next chapter. It's going to be worrying about the causes of the stress, which is very funny. Like you do have a stress and you're sitting here and again worrying about what can cause this stress. Oh my goodness. Alcohol abuse, yes. I mean, yes and no, I would say it depends from one person to another. For example, I know for some patients, they should have like a very little amount of alcohol before sleep because it can just put them to sleep well. But like if you would just have serious alcohol abuse problem, it can impact your sleep pattern. Like instead of sleeping more, you would just wake up in the middle of the night. You feel like thirsty and all that. I mean, you all are familiar with just being hangover and all that. But alcohol abuse can just impact a lot your sleeping pattern. On the other hand, if you would just sleep long hours, it can also impact your sleep quality, and it can bring some risk for psychopathology. So maybe I shouldn't sleep like 10 or 14 hours. Like I do that sometimes, like over the weekend or whenever I have time because I feel like I deserve. But yeah, but don't do that. 6 to 8 hours is okay. Rest, renewal, and savoring. It's a practice every day. So relaxation and renewal help people a lot to just have some sort of positive perspective towards life, reduce stress, and have like good emotional balance. Another point about this, I guess your book mentioned that how small changes, for example, having like a getaway or a short trip somewhere, or just hanging with your friends can just help you a lot to just have a more positive perspective toward life. And I would say it is very important. Even if you are introvert, just try to just do some group activities like running or just even be in some dance classes. You don't need to just hang out with everyone out there, but just being in a social group and seeing other people interacting can help you a lot. I mean, you don't need to necessarily go and say hi and all that. I mean, I mean, I do have a big part in myself, which is like introvert, which I mean, I show like I'm extrovert, but I am extrovert. But the point is, I do have some days that I don't want to just interact with anyone. Like, seriously, I mean, I'm done with just all social interaction, and that is fine. So on those days, I even just do some group activities because I like seeing people happy. So it just makes me feel better. So I'm telling you, even if you are introvert, try to just go somewhere, like for a walk in a park or like somewhere to just see some people. It can help you a lot to just have like some sort of positive feeling about yourself or have a good level of emotional balance and all that. So it seems like participation in some activities that can help you to just feel better, and enjoying those activities can just help you a lot to lower your blood pressure, have a better physical functioning, and have a better cognitive functioning, especially for older adults. So next week, we're going to talk about health compromising behavior. Um, a big part of that is marijuana. So that's why we do have a Snoop Dogg as our guest lecturer. I'm joking. But yeah, it's going to be all about health compromising behavior. I just wanted to do a quick, I just wanted to have a quick chat with you about your test three. I'm just checking your answers for different questions, especially the question about primary prevention. And another one was, my goodness, there was another one. I'm gonna tell you later. I might remember that. But the point is, your book is one of the most common books that is used for teaching health psychology, but it's not the perfect one because there are like some complicated, controversial concepts that your book just mention the title, but not actually go into that to just explain it in a good way. And that's why we do have lectures. So I'm just trying my best to just explain those parts, even with memes and all the funny pictures. But still, you have to check the lecture to just be able to get the correct answer for that. About the primary prevention question, the question is just asking you about the most common one. And in the lecture, I literally said that the most common one is just whenever we are going to someone directly and ask for help. For example, whenever you're going to your doctor and ask them for just giving you a prescription, or whenever you're going to a personal trainer and just asking them to train you for something. But if you are going to a focus group for like whatever reason you have, alcoholism, quitting cigarette or all that, it's gonna be, it is also primary prevention, but it is not the most common one. The most common one is just whenever you do have a problem, you are directly addressing that. The other question, my goodness, oh, it was about message framing. Oh, okay. So message framing, we talked about it can be positive, it can be negative. For example, you can just tell people, hey, you have to drink milk every day, otherwise you're gonna just lose. Oh, I'm sorry, this is my timer. Yes. You're gonna tell people, hey, you have to drink milk, otherwise you're gonna just lose your bones. This is a negative one. It might work for one person, but not another one. We do have some positive framing, which is like, oh, drinking milk is just very good for having a good bone or something like that. Again, it might work on some population for one specific person out there, but not for another one. So you cannot say positive is good for everyone. You cannot say negative message framing is good for everyone. You should say, based on the person who is in front of me, I'm gonna actually do a specific message framing that can just be applicable for that person. So your message framing should be based on the population that you are studying, based on the patient you have, and it has to be flexible. Okay, so that was one of the options that you should just actually go for that. So your message framing should be based on your population. It shouldn't be always positive, or it shouldn't be always negative. And again, I mentioned that in my lecture. I hope that for the next quiz, which is going to be quiz 4, you would check like all the different resources to just be able to answer every question. And again, if you feel like a question might not be the best, you can or if you have like some sort of confusion or all that, you can always email me and I'm here to answer you. I'm very fast at answering email, I would say. I really like interacting with you. So if you have like any questions, just reach out. Thank you so much for listening.